Hello, my name is Tsuyoshi Kaneko. I'm the Division Director of Cardiothoracic Surgery at Washington University in St. Louis. I'm also the Vice Chair of Education for the STS. This is an exciting time in adult cardiac surgery. We're seeing rapid advances in technology and techniques, along with new evidence that is shaping how we care for our patients with complex heart disease, both today, but more importantly, into the future. Decision-making in cardiovascular disease continue to evolve as new long-term data emerge. As surgeons, we must anchor our approach in the best approach evidence, especially as follow-up extends beyond 5 years. This question about TAVI and SAVR really had a big impact on the recent evidence that was published. 2 randomized controlled trials now report 6 to 7 year outcomes. In both trials, primary composite endpoints are similar between TAVI and SAVR. And we really have to be careful about just looking at the primary endpoints. In the Evolute low-risk trials, which reported 6-year outcomes, the reintervention rates, which were not in the primary endpoints, are higher with TAVI, 9.8% versus 5.0% with SAVR. The curves separate significantly after year 5, and most TAVR reinterventions involved surgical explant. The pattern is consistent across valve types and sizes, and this really raised some yellow flags of the durability of the transcatheter aortic valve. In the Partners 3 trial, which reported 7-year outcomes, the primary composite endpoint remained similar between the 2 groups. Early advantages with TAVR or TAVI diminished over time, but by landmark analysis at 1 year, death or disabling stroke is higher with TAVI. These findings reinforce a key point. Although the short-term outcomes are very important, the long-term follow-up, out to 10 years, is essential to fully understand the durability and the outcomes of 2 therapies. We have seen something similar with CABG and PCI, and we really have to be carefully assessing these data in the future. Again, the data that we have is only up to 6 to 7 years. There are some limitations with ages and other exclusion criteria, but the recent STS adult cardiac surgery data linked to the National Death Index did show an excellent 8-year survival for low-risk SAVR patients. 94% survival for STS PROM less than 1%, and 91.3% survival in patients aged 65 to 74. These outcomes establish an important benchmark and should be used in the conversation with the patients. So advances in technology and techniques will always generate excitement for both physicians and patients, but it's critical that we evaluate these developments rigorously through science. At the end of the day, it is our responsibility. Do no harm and ensure the best possible outcomes for our patients.